Hello, and welcome to the weekly dementia blog. My name is Dr. David Hutchings, and these again are being sponsored by SpectrumEd. Quick announcement: I'll be conducting a lecture with the Alzheimer's Association on Friday. This will be on Zoom. It was originally going to be a live conference, but obviously with COVID-19, that has moved to a virtual conference. So we're very looking forward to an hour-long lecture. We'll be discussing dementia, neuropathology, and symptom management. So looking forward to that as well. Kind of to piggyback, so the last 2 weeks we've been talking about sundowning and behaviors, some environmental modifications, and also some pharmacological interventions that we use that can certainly help with these behaviors. To kind of go with this a little bit and kind of piggyback on sundowning and behaviors, one of the things I want to talk about today was the use of routine. And I cannot say this enough. So routine is absolutely critical in all forms of dementia. And I know that that's something extremely difficult to do right now, especially with the pandemic going on. I'll actually be doing a lecture on the impact of dementia for a national conference on the impact of dementia and COVID-19 and social isolation. So we definitely want to be looking at a routine, and this could be making sure that information that we need, phone numbers, names, those types of things are laid out in an area on a consistent spot within the environment. So environment modification is very important, and home modification. Also making sure that our medications are given at the same time every single day. Meals are at the same time every single day. And if we're planning any kind of activities, making sure that those are actually planned at the same time every single day, or maybe if it's an every day we go for a walk or whatever it may be, make sure that's on the same day, on the same time. So making sure that those activities are there. Also, the use of large clocks and calendars can be helpful to kind of help. We don't necessarily want to always reorient the patient. That can actually increase behaviors. But in some of the earlier stages of dementia, some of the clocks and calendars can be very helpful. And also making sure that we are doing due diligence with our sitters as well. If we have a sitter coming into the home, making sure it's the same time and the same day of the week. And also managing doctor's appointments are very important as well. So I think that routine is critical for a couple of reasons. I mean, one of the things that we see is we try to immediately go for a medication to kind of decrease behaviors, or sometimes we can try the home modifications and the environmental modifications, and a really solid routine can help decrease some of these behaviors. So we're going to continue the series on what to do after the diagnosis. So we'll continue with our weekly blog again next week. Thank you very much.